All right. Thank you all for coming to the webinar this afternoon or this morning or this night, depending on where you are throughout the world. My name is Rob Bathurst. I'm the Managing Director of Healthcare and Life Sciences here at BlackBerry Cylance. And today we're going to be covering cybersecurity strategies for healthcare organizations, the rise of the AI workflow. The reason we focus this presentation around both strategy and AI workflow is that while I travel around to a lot of conferences, presentations, board meetings, and executive leadership summits, there tends to be confusion and distraction and just a lot of uncertainty as to what AI means, especially in the cybersecurity space, how it's generally applied, how it can impact workflows, how it impacts strategies, what you do with it, and how it's applicable. So that is what we'll be covering for about the next 30 minutes or so. And what we're going to touch on, as I said before, is kind of the history, the strengths, practical examples of what artificial intelligence is, how it impacts healthcare organizations, where it can be found throughout both the health delivery side and on the medical device manufacturer side. Cylance's security solutions and kind of how they're oriented towards the AI and machine learning space and what they do and why it's applicable. Then we're going to look at the preventative approach, which realistically speaking, if you're utilizing AI in the healthcare space, much like you want to prevent patient readmission in situations where you've treated a condition, you will want to use the preventative approach to preventing infection, preventing a patient zero, and then potentially dealing with the diagnostic side of it if for some reason something gets through. But again, if you're leveraging AI and you're doing it in a way that's meaningful to a healthcare organization that works in really disparate functions and workflows, you really want to focus on preventative first, respond and react second. And then together they form that overall strategy of how you deal with things. Traditionally, it's that defense in depth concept, right? So it's the firewall and then the router, then the proxy, and then the switches and the AV and the endpoint detection and management suites. But really kind of looking at the function of how AI impacts those workflows and how AI impacts that process. Then we'll go into use case and just kind of an example of what a cybersecurity process looks like with the Cylance technology in general, as it's the one I'm most familiar with. And then we'll look at just an approach to security. So with that, Cylance's mission, for those that are you unaware, is basically protect every computer, user, thing, widget, device under the sun. That comes in the form of the anti-malware solutions, that comes in the form of EDR, that comes in the form of helping understand whether the person in front of the keyboard is actually that person. And the core of all of this, and the reason we were very successful with what we did and why we were acquired by BlackBerry, is at the core of all of that is these artificial intelligence and machine learning concepts. The AI model, the way it learns, the way it's trained, the way it's placed, all of those form a critical piece in an overall much larger chain that points to a good application of AI in the cybersecurity space. Now, there are several others which I'll touch on to give examples of things like the EMR, things in diagnostics, things in cancer research, things in laboratory systems that all also use AI and ML concepts. But the key is to understand them, understand the strategies behind them, and understand how to apply them. So why artificial intelligence and machine learning? This is, as I alluded to earlier, helps us respond in real time to threats at the level at which the machine can mathematically reason an answer. And it allows us to look at things far beyond what the human perception is capable of dealing with. So when we look at it, and when I get into it to how we build models and why they matter, there is the concept of feature detection, there is the concept of modeling, there is the concept of efficiency. And all of these things go in together to form what we traditionally look at as an analyst. An analyst will look at a file, they will decompile it, they will deconstruct it, and they will look through it, and then they will go, okay, how does this matter to us? Why does this matter? Does this look like a malware function? Does it not look like a malware function? It's very similar to how the traditional patient care method is approached in a lot of HDOs. Is we diagnose the patient with our initial assumption, our hypothesis, then we go through and we figure out whether or not, based on the diagnostics that return to us, whether or not the hypothesis was correct, then attempt a form of treatment and see whether or not the patient recovers, gets better, improves, et cetera, et cetera. That same principle has been applied in the IT help desk scenario. It's been applied in cybersecurity. It's been applied in maintenance, in everything from medical device maintenance all the way through turbines that power the Hoover Dam. You know, that concept of assumption, diagnostic, reporting or confirming on the assumption, making an attempt to correct, and then going forward has been there and is prevalent. And so as compute power has increased, we have been able to leverage artificial intelligence and machine learning simply because the cloud computing and the actual speed of memory and silicon has reached the point where we can effectively model these data points and these behaviors and these issues and these reasons well enough to distill them into a model with a high degree of accuracy. You will find this AI and ML concepts both from a impractical commercial marketing solution, which will cover what to look for there and why it matters to your overall strategy, to very practical things, as I was mentioning before, for things like oncology, samples analysis, stuff that's used most likely throughout the hospital environment today. So Cylance's security solutions and what it's focused around, and why I want to touch on this is because it's this concept of continuous prevention, the concept of how AI can be utilized in an effective manner, and what we're doing and why we're doing it the way we're doing it. So Protect is a preventative solution. It is meant to be the shield. It's meant to use the power of an AI model to make disconnected decisions in isolation so that it doesn't have cloud reliance, that it doesn't have signature or update issues, so that it doesn't have to work on an analyst determining whether or not the system is functioning correctly. So that is the kind of first practical example, or I should say meaningful example, of artificial intelligence and machine learning applied to the cybersecurity space from an anti-malware perspective. So in a lot of our HDO customers and a lot of our medical device manufacturers we work with for integrating the technology, the most meaningful part of the strategy is be able to protect the device in an offline and disconnected mode. And that's where AI has a lot of benefits and strengths when the model, when the ability to detect, when the brains of that system are able to be resident on the endpoint system. As with all things, though, it's not 100% effective. As nice as it would be for us to go, it's 99.99999. In reality, it's going to hover somewhere around 99. It will not be perfect. It will go up, it will go down as models train and evolve, and new potential techniques and concepts are out there. And so to cover that, we took the same model concept. How do I build a model to represent good and bad? How do I build a model to determine what's going on this system? How do I build a model to help me hunt for a particular type of activity? And applied that to optics. Optics is the endpoint detection and response side of the platform that literally goes through and takes these micro models, almost these subsets, these models that are designed to help answer a very specific question and give you that visibility of what's actually happening in the endpoint. Whereas Protect can run entirely disconnected and optics can run entirely disconnected, the reporting feature that's cloud-based is the only thing that's actually connected. So the key there is the models for both systems all rely on what's local, and then any secondary analysis beyond the initial decision to protect is taken place in that cloud control console. And then lastly, we have security services that leverage AI and different concepts for things like incident response, detection, prevention, compromise assessments, red team services, and so on. Again, the reason to point this out is an application of AI before we get into the actual core of what it is and why it matters to an HDO. So everybody in the cybersecurity space has generally been trying to take the messaging and the standpoint of the model is there so that you can replace people. The model is there so you can do this. The model is there so you can do that. We use AI to stop this. We use AI to detect that. But in reality, the core of your AI strategy in an HDO and in general, or as a device manufacturer or someone just associated with healthcare, it should be to prevent infection. It should be to increase the productivity of a system. It should be able to lower the overall operational costs. That doesn't mean replacing people. It doesn't mean changing people, just like you wouldn't fire a physician because you received a new MRI that's able to do a more accurate diagnostic imaging that may have some form of artificial intelligence on it that's able to highlight tumors or masses or issues. You wouldn't simply get rid of the expert because now a system helps that expert identify things. You want to actually look at it and how do you use it so that you can do predictive analysis. If you're using a good AI strategy, you're looking at things not only from the how do I prevent this, how do I detect it, how does it stop it before it gets damaged, but how do I then transition this strategy into being able to be preventative and predictive? So if your AI technology, whether it be on the endpoint from an anti-malware perspective, from an endpoint detection and response perspective, or just a log analysis on your SIEM, it's how is this model, how is this technology, how is this capability going to help me be preventative and help me be agile and help me be predictive of threats or issues or files that may come. And so a lot when I go to talk to organizations, the healthcare space is tremendously complex, both on the healthcare delivery side and on the technology side. And so that comes to the last point of reducing layers and optimizing the security stack. The goal is not to reduce everything to a single endpoint or a single client or a single technology. The goal is to reduce the complexity because simplicity can be secured. Complexity increases risk. The more agents you have, the more code you have running, the more issues you have out there, the more files that need to be updated. Each one induces a potential point of failure in the overall security posture that can cause a catastrophic effect across the entirety of the organization. A 10-year-old legacy medical device that's not connected to anything and never has the capability to connect is not necessarily a risk, but that device that has the ability to connect, that was brought into the environment that your tools are not capable of detecting or understanding or finding or properly managing the asset, has risk. Your endpoint protection systems, your network firewalls, your strategies, your governance models that don't take into account for the potential for a human not to be able to interact with the system, and that you need that AI, that ML, that decision support system there. That is really the core and the benefit. So always think when evaluating a strategy for AI, what does it get me to? Does it get me to a preventative state? Does it get me to be able to predict things? Does it get me to a point where overall I'm lessening the potential risk and impact to patients? So security solutions use cases, right? So I get into a lot of these conversations and we talk about, well, what can AI be used for in the cybersecurity space? What can the solutions that can be provided with it, and how does it matter? Well, you can use it to prevent, right? You can use an AI model to prevent because you're not constantly catching up with DAT files. You're not constantly catching up with signatures. So you could look at a technology like a Protect to go in and say, I want to prevent a successful attack. That could be anywhere along the kill chain. So Protect specifically prevents the execution of malware, but there are other companies that have other technologies that have attempted to model exploits, the actual triggers by which a condition can be exploited. So is that there? Is the system in a safe state? Is there an exploit that could happen? Even though it's a protect agent itself, we have anti-exploit mechanisms and other capabilities. But again, preventing a successful attack is the first part of the strategy. Can I prevent it? Secondarily, you go into investigating an attack and alerting on data, looking for lateral migration. Different models can be built for these types of activities, but they're more complex. And when I get into how you build, how you build and classify models, you'll start to understand why. The actual investigation of an attack, looking for a condition to have occurred, looking for the absence or presence of a multifaceted or multidimensional object is complicated. And so investigating attacks and properly categorizing alert data takes a lot of information. It takes SIM information, it takes visibility information, it takes proper instrumentation. So as part of your strategy, if you're looking at an EDR platform, you have to understand how it's being instrumented, where the data is being analyzed. Is it network analyzation? Is it network analysis? Is it local endpoint analysis? Does it follow a Tanium type model for how it categorizes and retrieves data? Very important to understand. Threat hunting, again, models. You can model certain behaviors and patterns and indicators of compromise that you're looking for, and it helps speed up the ability to target a threat inside of your environment, determine if it's there. Dynamic threat detection, I touched on a little bit when I was talking about how you prevent attacks, how you prevent threats and risks from actually taking place inside the environment. One of the most interesting applications of potentially the future of AI and healthcare-based solutions are the prevention of widespread incidents and attacks using things like Demisto, using things like automated coordination, using things like response actions, which is the last category. But combining them together, you look at ways for different independent AI models to be able to send actions and alerts to secondary systems as part of an automated response chain. And that should eventually be where you as a healthcare organization or a healthcare associated organization want to get to, is preventing the occurrence from happening, preventing a widespread incident or lateral migration, and taking a automated response to that. The goal is to empower the personnel you have and make them operate at a more efficient, a more productive, and a better level by taking advantage of these security solutions that are built on these AI use cases. So now we'll get into the kind of the fun parts. I promise there is no actual anything in here about mathematics other than some stuff. But if you'd like to talk about that, I or our data sciences team is always happy to discuss that. But what I want to touch on is the key fundamental concepts and kind of take away some of the mystery of what AI is and what machine learning is and statistics and the differences between them. So AI is the big umbrella. AI covers many, many things. It covers neural networks and training models and statistical analysis and machine learning and expert decision support systems and all these bits and bobs, right? And you start to look at how the data science side of things and the statistics side of things come together to create a machine learning model. So data science is primarily what we're concerned with as an interdisciplinary science, that its goal is to understand data. It's to explore it, it's to prepare it, it's to present it, it's to transform it, compute with it, visualize it, whatever it happens to be. But data science, when you hear people talk about data science, it is literally the everything to do with data, everything from the management to the governance to the application to the domain specific issues. That's data science. Statistics is the relationship between data and a hypothesis. How often does this particular thing occur? How often does this issue take place? And so machine learning sits in between. Machine learning is that field of artificial intelligence crossed over with statistics that gives us the ability to accurately model with a high degree of efficacy a particular a behavior or a particular condition. And so when you think about your cybersecurity strategy as a healthcare organization, the key is to really understand, what am I trying to do with the data? What's my statistical relevance for this, happening? What does it matter? What kind of threshold do I need to meet? If I'm trying to prevent infections, I need to be as high as I possibly can. If I'm replacing a current system with a new system that gives me a capability that was non-existent, it might be more reasonable for me to expect a 60% efficacy or a 70% efficacy or an 80% efficacy. But understanding the data it's using, the modeling techniques it's utilizing, and the statistical relevance of what it's doing helps you understand how to apply that AI to the overall strategy. And so when you have these conversations with vendors, be it us or anyone else, really take a look at that and really understand the data, the statistical side of it, and what you want that model to achieve. Now, at the CISO level and the CIO and the board level, they care less about that and more if a business objective is being met. But by understanding these three kind of key areas, it helps you as an organization frame the answer to whether or not it will meet the business need. So quickly touch on the history of AI, right? Artificial intelligence and approaches to it are not new. Neural networking, doing clusters, doing linear regression, doing different modeling to determine whether or not facial features, identification, computer vision, all of these things are not new, but they're all under the big umbrella of artificial intelligence, which is why it's not good from a marketing perspective to just accept that they do AI, so they must know what they're doing. As I'll touch on over the next couple slides, is the answer always has to be, do I know what I'm doing with this? Do I know why I'm doing this? Does a linear regression model make sense for this particular application of AI as it applies to my strategy? Who knows? That's not the point of you asking the question. Asking the question is, do they understand the application of AI, whether it be visual analytics for computer vision or whether it be linear regression models for detecting whether or not something is good or bad? Does the person talking to you even understand the concepts of what they're trying to do? That is the most important thing. If the vendor can't even explain the applications of what they're doing, then either they just don't understand, weren't properly taught, or the person just can't grasp what's going on. Sometimes, and several years ago, 6-7 years ago, when we first started the AI journey and the approach and taking AI to the mass market in the cybersecurity space, about a year or two after that, several companies said, oh, we have AI too. In reality, that's not a practical answer, because what they were doing for AI might not have had any practical impact on the efficacy or delivery of the solution. And the last thing you want is somebody giving you a false sense of security saying, oh, our stuff's as good as their stuff, but the way we use AI isn't really practical for the solution. So again, just kind of talk those conversations with people as you apply it to your strategy. How do you use AI and how does that matter to me? So I want to touch on a concept next when talking about machine learning to explain the difference between supervised and unsupervised learning. I've heard a lot of people, I've worked with a lot of CISOs and CIOs and executive staff at a lot of healthcare organizations, and they get 15 to 20 pitches a day about what machine learning is and what machine learning isn't, right? They talk about how vendor A's models are better than vendor B's because they do this and then they don't do that. Well, this is the definition of the two primary types of machine learning, which are supervised and unsupervised learning. If you look at the most practical example, and I'll get into what these bullet points under them mean, the most practical example is supervised learning is well used when you're trying to determine an A or B answer. Is this a dog or a cat? If you're doing unsupervised learning, the most practical example in the healthcare space is what I was talking about before with oncology. You know, how they take these cell samples, how they take genetic material, DNA makeup, whatever it happens to be of oncology patients, and start to do unsupervised learning to figure out what the relationships between these samples are. And so when we start to look at how the machine learning is applied to cybersecurity technologies, we start to understand what one might be useful for versus the other. So supervised machine learning is when, as I said before, you want an A or B answer. It's when the ground truth of information, it's when you have a plentiful source of whether or not something is good or bad. So if you're looking at Protect's core model, it's telling you, is malware good or bad, or is it somewhere in between? So when we look at supervised machine learning, our giant processing network up in the cloud goes through and says, I have 500 million good samples and 500 million bad samples, and I'm going to distill a model that gives me the relative representative attributes of each of those together. And so it creates distinct categories. It figures out a easy way for us to, using supervised machine learning, we're able to figure out the quality of a classifier. Is what we're doing accurate? Is this being classified correctly? So when you're dealing with from a strategic perspective, when you're looking at technologies in the healthcare organization you're dealing with, and they say, oh, we do supervised learning, the first question out of your mouth should be, what are you doing it for? And where's the model? And what is the model answering? If it's a yes or no question, is this good? Is this bad? Is this harmful? Is this not harmful? Is it a threat? Is it not a threat? That should be the first indicator whether or not the vendor has the applicable knowledge to be able to understand their solution. And then secondarily, you can go into things like, what is the model being used for, and how are you determining or classifying what type of thing is happening? How are you determining those attributes? Is it fully automated? Is it fully model dependent, or is it human? Is there human analysis behind it? So again, supervised learning, yes or no questions, dogs or cats, raining, not raining, easy things to detect if you have lots of plentiful, correct information, and easy to do if you have a large corpus of samples with which to train the model. Unsupervised learning is what's used when, as I talked about before, in cell samples, there's little or no information about what's in the data set you're dealing with. So you might see unsupervised learning techniques or continuous learning techniques in things that have no way to establish a base truth, a base model. And so those are going to might be things like STEM data, stuff that's just flowing in that has no relevance to each other, but yet you want to figure out what's going on. It might be attack patterns. It might be signatures out of a firewall or an IDS IPS system. And the downside to a unsupervised machine learning approach is it takes qualitative human analysis. It takes human correction to understand whether or not the model is built and responding appropriately for what you want it to do. If you think of the first simplistic uses of kind of unsupervised machine learning, might be something like the speaking dragon from back in the day that used to try and tell you whether or not you're speaking the words correctly, because it went there and tried to train over and over again on what was happening, but it wasn't pre-trained. It didn't know your voice. It didn't know what you were doing. The model couldn't be put there, so it might have used that technique. It could have just used voice modulation statistics, but again, we're just talking about these two primary classes. So when someone comes to you and says they use machine learning, ask them as part of your strategy, is it supervised? Is it unsupervised? Can you answer the question what it's for? Why is it doing this? How is it relevant to my organization? How does it overall lessen the impact to patients? So AI strengths, right? So this is a relatively quick slide, but in the many conversations I've had, there is again a misnomer of what AI is for, especially machine learning. right? Much as data science and statistics overlap together to create machine learning, you have good questions and bad questions, and somewhere they overlap and give you a answerable grouping. So good questions for AI are, is this good or is this bad? What is good? How are these relevant? Does this follow a trend? Things that machine learning are bad for are complex and amorphous questions. What is secure? Will I like lunch? Now, will I like lunch is if you had a mass amount of data on your, the star ratings on Yelp or whatever it happens to be, it might be able to make a statistical determination that you probably like this place based on someone else's ratings. But again, it has no relevance to classify that restaurant in any other way other than comparing that source of truth that it has, your opinion about a restaurant, to something else. So for a technology that you're trying to automate and create response techniques out of, that you're trying to orient your strategy around, will I like lunch is a bad question. And then, the complex question is, what's the airspeed velocity of an unladen swallow? Again, several variables, several factors go into it, and so it's not a simplistic answer. If you look at how we categorize things as human beings, we attempt to simplify as much as we can the individual attributes out of it. And so, like the last question, airspeed, we look at things in a vacuum. How fast can it fly at this altitude with this much weight in this way? And if it ever goes outside of those parameters, it's completely variable. Same thing when we're talking about security strategies, especially in the healthcare space, is saying, oh, I can detect and find all of your medical devices, or, oh, I can help you properly categorize your risk, or I can determine whether or not a doctor or a nurse or someone is doing something incorrectly because I use machine learning and AI. It's not an applicable strategy just to believe it and to understand that they can or can't answer the question. The strategy is, what question are you asking? Does it have a simplistic enough answer? Is the answer going to give me some form of actionable intelligence or response? And what do I do afterwards? So again, play to AI's strengths, understand what AI is used for and how it applies to securing an HDO. You can have things that don't require AI in certain parts of your network or certain parts of your design. And then there are parts where AI should absolutely be used because it's impractical to think of human analysis being able to answer a question in a timely fashion. So practical uses of AI, as I said before, AI is everywhere, at least in some concepts, right? And it's only becoming more and more prevalent as we create these expert decision support systems all across our workloads. It can be anti-malware, it can be user behavior analysis, process automation, image processing, audio recognition, anything that automatically recalibrates itself is either using some form of statistics or some form of modeling to reestablish something to what its perceived baseline should be. Search refinement. Google is the best example of machine learning. How they do page ranking and analysis, how they do weighting, how they model responses. Same thing with Amazon. Amazon does all their modeling and shopping analysis. Probably the two most mature sectors for use of artificial intelligence and modeling and statistics are probably finance and shopping, because they have the largest and most instrumented set of data that makes it practical. So when looking at a solution for a healthcare organization, looking at how certain techniques might be applied in other industries can be very, very useful. And so understanding, again, how AI is applied and where it might be applied is great for an overall strategic plan. Incident response engagements, mineral processing, manufacturing, and so on. Some of these are relevant and some of them aren't, but if you think about it as an HDO, you have core IT assets, you have core medical and clinical support systems, and then you have medical devices themselves. Essentially speaking, you have IT systems and operational technologies. And healthcare is not the only industry that's trying to secure and understand the strategies around those. And so looking to the local power company in your region to talk to about their cybersecurity strategies might be very beneficial, because their operational technology, their industrial control systems are very similar in operation and design to the medical devices inside of your own environment. Or as a medical device manufacturer, looking at the practical lessons from the industrial control systems manufacturers can be very useful. So this is an example of what a cycle looks like using an AI approach to security. So we publish and deploy a model. The endpoint operates and monitors the results of the model. We define the objective, which is to confirm that a malicious threat or file has been blocked. We collect additional data. So in the case that we're permitted, we would collect additional portable executables, or in this case, Windows files that look potentially suspicious or that the model has never seen or interacted before or falls below a certain threshold. We parse and vectorize that data, which is that how do we classify it? How do we understand it? How do we take it apart and pull the attributes out? We look at the features and reduce dimensionality, which is a complex way of saying we take the features that the model thinks are relevant automatically, and then we reduce the complexity of the model's effort to make a decision by collapsing the space. And then we go through and train a model in our neural network to say whether or not this model is more efficient than the model and more the efficacy is better than the model before. Then we analyze, execute, and confirm that it's blocked, and then the cycle starts all over again. So what happens in the 5 through 7 side of it in this example is back-end stuff, whereas on the front side, the 1 through 4 is front side. And so endpoint facing versus back-end facing. But again, this is an example of how a model is deployed, what it does, how it's defined, how it collects data, and how it feeds back in for the next training cycle. Unsupervised models, as I touched on previously, unsupervised models have the advantage of being able to train asynchronously and then be placed onto an endpoint and maintain its efficacy. Unsupervised learning has to train relevant to the data set and is only applicable while it's on and working on that data set. So again, understanding how that's deployed and how it works affects your strategy. So closing thoughts, whether it's clinical support or cyber, knowing what AI technique is being applied is absolutely critical to your overall strategy. Understand the process and how it impacts the solution, cloud models versus endpoint models. Understand that AI is not the answer in all cases. Don't complicate a solution where a simple answer will do. Where you have a firewall, where you have something that already has well-defined rule sets that don't require complex analysis. Most times a deny any rule does not need AI behind it. It just does what it does. Some systems have complexities that AI will not solve right now. Medical device maintenance prediction is one that people are trying to do, but it's not easily solved as an example because each device functions differently. It's monitored differently. It's not something a generic system can deal with. And so when you understand the technologies you're evaluating as part of your solution, understand that some of them just can't be solved by AI, and just because somebody says they use AI doesn't mean that it's an answer you want. It might be an overly complex system for your team to utilize, and the AI might not be a benefit to you. Automation is a great thing. So as part of your overall strategy, understand that automating the response to or from an AI system can be great, but it does not replace basic housekeeping processes or people. It just makes them better. It makes them better at what they do. It makes it easier for them to deal with things. And then the point I brought up before, which is, talk to other firms, talk to cybersecurity companies like ourselves, talk to other CISOs, go to the Chime forums, go to the HIMSS forums, and talk to people about how they're implementing AI, how they're doing things, whether or not they've just had a general consultation on the application of AI and where it might benefit their organization. That right there can be a huge benefit just for edification. We do workshops where we teach people AI. We teach the understanding of where it can be applied and where it can't be applied and how it matches your strategy and your solution selection. So it's a huge thing. Second opinions are never bad in the healthcare space or in the cybersecurity space. And then lastly, trust the math, but verify the results. I can tell you it's great, but ultimately, you need to test out what's happening. Let's see here. There's a question. Is there an example of how AI is being used in healthcare in the cybersecurity domain? Yes. I mean, healthcare, two big examples I can look at, right? So if we talk of medical device manufacturers and IT systems, Cylance has a huge presence in the HDO space for protecting them from an anti-malware perspective. So the cybersecurity approach in healthcare is used there. And then our models are placed locally. The EDR models are placed locally. So yes, we protect that. And then another great example in the healthcare domain where cybersecurity principles and AI are being used is things like fair warning, stuff that does malicious monitoring of the EMR, the electronic medical records. They do different types of modeling. They do more UBA, like user behavior analysis, to figure out whether or not medical records are being improperly accessed or abused. And because of the complexity of medical records, it's really hard to do a straight rule set like you would in a firewall. And so that's a place that AI is being utilized for compliance and cybersecurity. And then lastly, there's a trend right now in the healthcare space for cybersecurity, specifically related to the application of users. So how do you determine what a user is? How do you determine what's going on with that user? Are they interacting properly as the applications they're accessing? So attempting to utilize AI in something like Cylance Persona to figure out whether or not somebody has stolen a credential from somewhere and is attempting to enter a system or do lateral migration. There's many more applications for AI in the healthcare space from a cybersecurity perspective, but those are kind of three big key examples. What you're going to see from a future perspective is you're going to see some of these AI cybersecurity tools and technologies and capabilities being implemented into medical devices probably within the next 2-3 years as they do their technology refresh and certifications for new things. Hopefully that answered your question. If you have any more, do feel free to reach out to us and let us know. We'd be happy to provide more examples. With that, if there's any more questions, I'll be happy to take them. Otherwise, thank you for taking the time to listen, and have a good day.